What's up, everybody? Jed Johnson here from dieselcrew.com. Of course, you know they call me Napalm. And I got another video in the 31 days of Q&A. Nobody has asked me this question ever that I recall. However, it's been a discussion topic here and there, mostly with people that I just know on a personal level, not YouTube commenters, not email subscribers or anything like that. And it has to do with spinal fusion surgery, based on some experience that I've had with people who've had this done. Today's video is brought to you by Neckvember because I have a program that is designed to help you strengthen your neck. It is not a program that's going to keep you from getting spinal fusion surgery or anything like that. I don't want to misrepresent. But if neck training is something that you need, neck strength is something that you need to improve, then Neckvember will help you out, and it will be in the description box. A link will be in the description box for Neckvember, along with the playlist link for this month and other links that you can use to support this channel, which so far nobody has really used this month, but I thought I would tell people about it. All right, so I want to approach this subject very carefully. And first off, I want to say, in case you don't know, I am not a doctor. Napalm is not a doctor. I'm definitely not a surgeon. My specialty is definitely not surgery of any kind. But like I said, I have people that are very close to me who have had encounters with spinal fusion surgery, and I feel like I would like to share this today because if I help one person with the information that I'm going to share today to avoid the need for spinal fusion surgery, then I've done my job. But take this video with a grain of salt. I encourage you to consult your doctor, your physician. I encourage you to get second opinions, third opinions, whatever the case may be, in order to try to explore all of your options. And I'm going to share with you a story that I recently saw online that may present, excuse me, another option for you. So a little bit of history. My dad was in a car accident in, I believe, 1996. So I was at my girlfriend's house at the time. I forget why, but I was outside, and all of a sudden she comes out the door running. She says, "Jedediah, get in the car." I'm like, she doesn't talk to me like this, and the only time she uses my full first name, it's a very serious situation. I said, "What?" She goes, "Jedediah, get in the car right now." So I get in the car, and she proceeds to tell me that my dad was in a motor vehicle accident. And we went to the emergency room. Apparently, my mom or somebody had called the house and let them know, and since I was outside, I didn't answer. This was before cell phones. So we get in the car, we go to the emergency room. And what had happened was, my dad was driving off the shoulder on the side of the road, and he was looking out his window like this, just creeping ever so slowly, to see if my uncle had either mowed his lawn or if the lawnmower was there, because my dad's lawnmower was in the garage or something like that, getting worked on. And my dad needed to borrow my uncle's lawnmower. About that time, he was hit in a head-on collision, which totaled his truck. And I don't know what vehicle hit him. I guess I've forgotten that. But I guess the guy that hit him was having some kind of a medical emergency and was trying to get medicine out of his glove box or something. At least this is what I remember. The point is, my dad had a head-on collision, and apparently they thought that he broke his collarbone, but he also injured his neck. And over the course of several years, my dad had to have at least 2 surgeries that I know of, and one of them involved spinal fusion in the cervical column. And what resulted in was he was getting these severe headaches for years, and he missed a whole bunch of time from work because of the severity of these headaches, and he ended up having to retire earlier than he would have. So he had to leave his job this injury. And in fact, those surgeries were really not that effective for him. He had days where he felt bad that he couldn't work because he had some good days where he felt just fine, but the majority of the time since 1996 has been a really bad situation. So, in fact, in 2016, I actually finally talked him into strength training, and it was the best he had felt in years. He was able to get off all of his pain medication, and I have this picture where we were walking in the parade through town, and he's smiling and actually tossing his coffee cup up in the air as he's walking. Sometime in 2017, as I recall, he ended up slipping on a hill and tore his rotator cuff while he was weed whacking, and he hasn't trained since then, and I'm still trying to get him back. But anyway, my dad's fine, not 100%, but he's doing good. I still got him. I'm lucky. However, today I found out that probably one of my best friends from high school, his wife had to recently get some kind of spinal surgery in her neck, and I didn't even know that she was injured, and I guess it hasn't gone that well. Conversely, I also know some people who have had successful spinal fusion surgeries, both for their neck and their back. So I'm not saying that it's all doom and gloom, and I'm not saying every time there's a spinal fusion surgery, it's going to go bad. That's not what I'm saying. A person very, very close to me, obviously my father, had a bad one. And I have some notes here. I'd like to stay in my lane, generally. In other words, I generally speak about my own expertise, my own experience, and stuff that I've gathered firsthand knowledge on. And I generally don't try to play the health professional. And at the same time, I don't like it when health professionals try to be personal trainers and strength coaches, and when they tell people they have an injury and they shouldn't train and they should just rest, and as a result they detrain and become even weaker. That kind of thing irritates me. And like I said, I would probably stay out of this topic. And again, I'm not a doctor. I don't know anything about surgery. I've never played one on TV. And there's probably risk in putting this out there, but I want to share something with you. There's going to be one other link in the description box. It's an interview done by James from WSI, Wrestling Shoe Interviews, and he is interviewing Val Venus. It's part 2 of the interview series with Val Venus. If you don't know Val Venus, he was a wrestler for the WWF. During the Attitude Era was his pinnacle of popularity, and at some point in his career he sustained a neck injury, which is very, very common for professional wrestlers. Despite the reputation that professional wrestling has, the physicality is not fake, and when your body is thrown against ropes and cables and drops onto the mat and the floor, and there's all this jolting millions of times during your career, accidents can happen and injuries can take place. And Val Venus sustained a neck injury. So if you go to the link in the description box, which is clearly labeled WSI interview with Val Venus, and you go to the 1 hour mark, he starts talking about his experience with a spinal injury, a disc injury, and how he prevented spinal fusion surgery. I'm going to give you the rundown, a synopsis, a summary. So basically he injured a disc in his neck in the ring, and he was feeling numbness and weakness in, I believe, his right arm. So his fingers were numb and he was losing strength in his right arm due to the disc injury that he sustained. And the doctor wanted to do spinal fusion surgery, which was going to keep Val Venus out of the ring for about a year. Now, if you're not familiar with professional wrestling, especially back in the 90s when this took place, if you did not wrestle in matches, then you did not get paid. Unless you had some other kind of endorsements, or if the company had you doing speaking tours or something like that, you didn't get paid. So for a wrestler to be out for a year, it meant potential serious hardship financially for that wrestler. Well, the doctor explained that what was going on was because the disc was injured, it was getting dehydrated. So in order to get fluids and nutrients and things, it would swell up, and it would then put pressure on nerves, which resulted in that numbness, that tingling, and that weakness down into his arm. So eventually, along some lines, Val Venus proposed traction. So if you're not familiar with traction, if you've ever been to a chiropractor's office, you might have seen a traction table, and they can do traction on your lower back, they can do traction on your neck. For the neck, for the neck and back, basically what is going on with traction is there's pressure applied to your head for your neck and to your hips for your lumbar spine, and then it pulls the spine apart, so it creates more distance between the bones and it allows for a situation for the disc to heal, if you will. This is very, very high level. This is 40,000 feet. So basically, Val Venus suggested, what if I do traction? Will that help my neck? And the quote that I have here from the interview was, "Cool idea, kid, but you need to get cut." So the way that Val Venus looked at it is, well, if I get surgery, I'm going to be out a year. What if I do traction for 2 weeks? Because what's the difference between 1 year or a year and 2 weeks? And what he did was he ordered a spinal traction device, which somehow gets connected to a doorway. Very, very simple device. So it's not what you would get at a chiropractor's office, but it's something that you can do at home. And he said the protocol that he followed was a half hour of traction in the morning, at noon, and at night. And he did this for 2 weeks. So a half hour, 3 times a day for 2 weeks, just sitting in a chair with a traction device in front of a doorway. And after 4 days, he said the finger numbness went away. And at the end of 2 weeks, strength started coming back into his arm. So there seemed to be some pretty promising results after just 2 weeks. So he notified the doctor, and I think they kind of blew him off. So he didn't go and get the surgery right away. He stayed the course for 6 months. And, he stayed the course, and then 6 months later, he was back in the ring taking bumps, meaning he was doing live action moves. It's just he wasn't in the ring on TV. He was doing practice, if you will, in a ring, falling down onto his back, getting all these jolts and stuff like that. And he was able to return to the ring. He eventually ended up wrestling full time for several years after this. At one point, he got cleared. They did an MRI, and when they did that MRI, his spine looked like a normal spine. There was no longer an injury. And like I said, he wrestled full time for several years after that. So, I mean, in my opinion, this is a pretty promising thing. That's why I'm passing it on. I consume a lot of wrestling podcasts. I love listening to these guys talk about the business. If there's anything I regret in my life, it's not having ever trained in professional wrestling. If there was one thing that I could go back and change about my life, the only thing that I would change is that I never wrestled. So I have a tremendous amount of respect for these professional wrestlers. And while Val Venus could be seen as a very short time wrestler as far as his fame is concerned, and you might say he was a flash in the pan to some degree, he still was a featured wrestler on Monday Night Raw, making hundreds of thousands of dollars a year probably, at his peak. So, and anybody that's on the roster for any given amount of time, especially during the Attitude Era, you have to consider a phenomenal performer in their own regard. So while professional wrestling is not a top level sporting event or athletic endeavor, it's extremely physical. It's extremely physical. And honestly, when I entertained getting into professional wrestling, the physicality was so high that I just talked myself out of it, because at the time I was 37 years old, and the prospects of ever getting a real deal that made money was minimal, and I didn't want to miss the time with my daughter, so I never ended up doing it. But there was a pro wrestling school less than an hour and a half away from me, and if I would have known that when I first got out of college, I would have been there. Anyway, that's not the point of this video. The point of this video is, I'm sure there are people who are dealing with neck injuries right now watching this video, and maybe the suggestion of surgery has been tossed around by a surgeon. And what I encourage you to do is take this video and watch the video that I shared, listen to Val Venus's story, and maybe there's some potential there for you to avoid surgery. Obviously, there's lots of risks with surgery. You have to be put under anesthesia or whatever. There's a long recovery time. You could miss work because of it. It might have to affect your ability to lift. All these things are really important, among other things that I haven't touched on. But there's risk involved, and it might not work, and you might be just as bad afterwards. So I encourage people to always get second opinions and try other options before getting surgery in order to prevent that whenever possible. So that's why I'm sharing this video. And I will just add one thing. Val Venus says he still tractions a few times a month in order to keep his neck healthy, because that is a lot of wear and tear that is accumulated over the years. So if anybody's watching this and you're being confronted with the possibility of needing spinal fusion surgery, I encourage you to check this out and run it by your doctor or physician to see if this might be something that could help you prevent the need for that surgery. If neck training is just something that you want to opt to do, you want to get a bigger neck, you want to get a stronger neck, maybe you're a football player or wrestler, then neck training is going to be very important to you. Get a good quality program like Neckvember. It's in the description box, along with the video that I referenced with this interview, along with the playlist video for the 31 days of Q&A, and along with the other links that you can use to help support this channel. Any questions, leave them below. Submit questions for the 31 days of Q&A. The reason I'm doing this is I'm not getting that many questions, so I'm sticking this in there since I found out my best friend's wife had to go under the knife. All the best in your training, everybody. Give it one of these. Be sure to subscribe, and take care.